A medical emergency can occur during another emergency or it can occur all by itself. We average about 55 medical emergencies on campus every year. So one of the first things to do would be to call security and inform them that we have an emergent situation on campus. Let us know as much information as possible. The next thing is tell someone else to call 911. In CPR training, they specifically tell you to direct someone to do it. If you don't tell someone to do it, then no one may do it. So you might say, you go call 911 and you go call security, and give them a clear directive as to what to do. And one of the most critical things is have someone come out and meet the emergency responder that's arriving, because seconds count during an emergency and we want to get to them as quickly as possible. During an emergency, and especially medical emergencies, be aware of biological hazards. This is also often called practicing universal precautions. This means that if you come in any contact with blood or bodily fluid, those things can be contaminated. Be sure that you've used universal precautions by putting on gloves or maybe goggles, something that helps cover up your face, your eyes, and your hands. If you do find that you've touched something, then I strongly recommend that you seek a physician's care within 24 hours. Let your supervisor know that you've been exposed and seek medical attention. All right, let's speak for a moment about automatic external defibrillators. Most of you know them as AEDs. We have AEDs around the campus placed in the most common locations, such as the pub, the 9000 building, the gym, the 3000 building, and the dental hygiene building in the 2500 building. Security also carries a mobile unit, so we will always have that with us when we respond to a location. Tell someone to call 911 if you believe that the person is having a heart attack or a stroke. Begin CPR if you have the training. And of course, call security that you've called 911 and let us know that as well. Now, AEDs in some of these locations have a striped casing around them. That box that they're in does have an alarm on the box. So please do not open it and try to practice. But if you needed to use one, they are very easy to use. Once you open the box, there is a big red button inside the box. And when you push that, it easily and clearly talks you through the steps. There will be 2 pads inside the box that you place on the person's chest, on the front of their chest, and on the side of their chest next to their heart. So you can place those in those 2 locations. If nothing else, just place both pads directly on the front of their chest. And you start the machine and it will walk you through exactly what to do. Don't touch the person once you've begun to activate the machine for the shocks. Even if the person is not having a heart attack, you won't harm them if you use an AED machine on them. It's better to do it than not do it. Another small but possible risk on a college campus is known as hazardous material response. So a hazmat incident could occur if something is leaking, mixes together, possibly fumes or smells that you might be experiencing. One of the most important things to know is just do not touch the product if it's something that you see coming together, and warn others to stay away from it. You might block it off by putting some chairs or a piece of tape or something around it just so that others stay away from it, and be sure that you're calling 911 and security so that we can respond to assist you and that 911 is on the way. Hazardous materials are something we let the fire department address. So we would like to come and assist and keep people out of the area, but just be sure the most important thing is that you don't touch it. Try to get away from the area. Now, we're very familiar with weather and storms in our area. And during high winds outside, it might be best to stay inside the building. Building monitors will be able to come around and assist us with this sort of emergency and give you information on what we're going to do on campus. You also want to watch your phone so that you will receive the emergency alerts. You might get a text, you might get an email about what possible closures could occur and any further communication. We had a snowstorm about 2-3 years back, and we learned a lot from that. And during a snowstorm, what we know now is that we will allow all students to leave the campus first, and employees, because we're being compensated, will stay behind until we can evacuate the majority of the students. We only have 3 egress points on this campus, so we're all basically filtering out to the same locations. It's very difficult to do when everyone tries to leave at once. So try to help coordinate having students leave first, and then you will continue to get information on employees leaving and if the campus will be remaining open or closed.